So, Jalisha, I'm going to have you turn and lay down on your left side, please. Okay. So, now the patient is on your left side. What should we do first?
Flex elbows and place arms up by the patient's head.
All right, so good. Yep. Both hands up by your head. Very good. What else should we do?
Flex the legs back on each other to stabilize the patient.
Good. So just bend your legs a little bit more. Feet right on top of each other. Perfect. If you had an extra pillow, you could even put the pillow here between the knees for patient comfort. What else do we need to do?
Make sure there's no rotation.
Okay, so we need to make sure that the patient is straight once again. But now, not only are we making sure that their MCP is straight along the table, we also need to make sure they aren't turned or rotated. When they're PA, when they're supine or prone, it's usually pretty easy to get them to lay flat. But here, you need to be very careful, check shoulders, check back, check all around to make sure that they are not rotated, to make sure they are straight. Okay. In addition, Jalisha, I'm going to take this pillow and just slide it up a little bit. Good. Okay, that down. I don't want the pillow too far down because then that's going to cause her to lift up and it's going to create some tilt in her. So, for you at the ends of the table, does her MCP look straight?
Looks.
No.
No, I don't think so.
Are her shoulders supposed to be in the same?
Perpendicular to the.
Her shoulders are a little bit forward than her.
Okay, good. So the shoulders and hips aren't in a straight line right now. So you can either ask the patient, can you slide your shoulders backwards, back towards me? Good, thank you. Okay. Or you could ask the patient, can you slide your hips forward? Okay. Either way. Okay. Looks better now? Okay. So we're going to come over here, make sure that the back is straight, bring this shoulder back. Make sure that the hips are straight. Good. We want it straight all the way through. All right. Let's take a look now. How is this? Okay. Looks good. So this is the proper patient positioning for the lateral. Right? Get the patient nice and straight. What is our next step?
Lock the tube laterally so it is centered to the table.
Good. So once again, we're going to take the tube. We're going to make sure that we're locked in up top. Green light. And then what do we do?
Bring the tube over the center of the table so that it is centered with the table bucky.
Good. So once again, we're going to make sure that we're centered with this dot right here on our bucky. Okay. And then what do we do?
40 SID.
Good. 40 SID. Just bring this down until it clicks into place. Okay.
Now we float the table.
And now we float the table. Where are we centering to this time?
MCP.
MCP and
The iliac.
the iliac crest. Okay. So for this, usually people find this a bit easier. Right, iliac crest is on the side is now up, so it's easy to just put your hand here, feel for it, okay? And it's right there. So, okay, I've marked the iliac crest with my hand, and just float right over there. Okay, top of the crest, and there's my central rib. Okay. And so now I need to center to the MCP. So how can I center to the MCP? Okay. Well, if you pat the clothes down, you can try and find the midline between the back and the front. Or you can just use your light. Make sure that you have even light on both sides. So let's try that. I'm just going to take my marker, mark my iliac crest, okay, right here, down the center. Okay, sorry, Jalisha. So I have light in the front, I do not have light in the back. So I'm going to take this little bit. Okay, oops, too much. Should be something more like that. Right, so I've got a little bit of light in the back, I have a little bit of light in the front. Just gonna walk around, double check, make sure everything looks good. Okay. Everyone comfortable with how I did the centering there? Look for iliac crest, and just move back and forth until we get light the same on both sides, straight down the middle of this MCP. Okay. Now, because most people are thinner front to back than they are side to side, we can actually collimate a bit more on this one. Okay, so we're going to collimate in, we'll get rid of some of that light in the front and the back. Oh, just make sure you don't collimate too much to where you start clipping off the abdomen. Right, your borders are going to be the ribs. Right? Back the ribs, front the ribs. As long as you have that, you have the abdomen. Anything past that is just, well, you're going to have soft tissue there. So you do also want to get that soft tissue, since that is part of the abdomen as well. All right, which marker are we going to use?
Left.
Left.
Good, left marker, because left side is down on the table. Where do we put this marker? Good, towards the front of the patient. Just gonna find some light and put the marker right here inside the light. Okay. What are the breathing instructions? Good. Same as before. So breathe in, breathe out, stop breathing, don't breathe. X-ray, breathe normally. Very good.